Welcome back to Do No Harm, where we fight for patients and against identity politics in healthcare. Podcast hosts Benita Cotton-Orr and Dr. Stanley Goldfarb will highlight the medical industry's most pressing issues and dangerous trends, and discuss how we can achieve a better healthcare system for all.
I'd like to talk a little today about politics in medicine. When did politics become such a big part of medicine, and how?
Oh, well, I guess, the origins a little bit actually date to, and this is a little bit uncertain, back right after World War II. There was the obvious kind of reorganization of societies that occurred after that horrible conflict, particularly in Europe. And there was actually a Catholic priest who was sort of a neo-Marxist priest named Ivan Illich, who wrote extensively about social issues and medicine. And he raised the fact that in his eyes, there needed to be a much greater emphasis on social issues in medicine and public health than there needed to be on the care of individual patients. He wrote a book called The Medical Nemesis, and in that book, he raised the concept of iatrogenesis, was his idea. And iatrogenesis meant that it was illness induced by physicians rather than illness that came from natural causes. And he felt that the technology in medicine that was developing at that time actually produced more harm than good, and that it was much better to spend resources of society on public health issues, on prevention, and on allowing people to suffer. It was part of his theology in medicine ideas, rather than to intrude on the natural course of illness. So this rather radical set of ideas really spawned a movement towards focusing more on public health issues rather than on the care of individual patients in medicine, and that society should focus on public health issues rather than spending large amounts of money developing, academic medical centers and hospitals that might treat people with advanced illnesses. And again, when there was the battle between communism and capitalism and the communist world versus the free world at that time, some of these ideas became embedded in the political notions that were extant at the time. And I really think that's the origin of it. And then again, we had the issues of the sorts of uprisings that occurred in the United States among students at that time and in academic centers, where there was a pushback against many of the sort of classical capitalist ideas that were in society, and led to physicians adopting what had previously been mostly a very conservative ethic in the medical world into one that encompassed people that had much more of an idea of having social activism as part of medical care. So I think these threads sort of have come together to imbue medical education at this time and have a fairly large number of practitioners of medicine feel that these social issues are critically important. I must say, every time I've been confronted by them with these issues, my question has always been, okay, fine, let's accept that social issues are important. How do they work? How do they produce illness? And how do they contribute to illness? And secondly, what can you do about the social problems that you encounter? And the answer is always, which is the way I treated my patients, is let's refer them to a social worker who actually has the skills and the ability to intervene when intervention is possible.
So my ears pricked up a little there when you said capitalism, because I think that's the first time you've mentioned that term. So what does capitalism have to do with the woke policies and the social activism, and why is the concept of capitalism even a part of this discussion?
Well, it's interesting why free markets are seen as some sort of major problem, and by people of the left, basically. And I think they're mistaken in this. I think, in fact, the great advances that have occurred and the great movements out of poverty that have occurred in the world, for example, in China, have occurred because governments understood that free markets were the best possibility of allowing the society to accumulate enough wealth to create better social conditions for society. That's been true in China. It's been true in every country that's emerged. Vietnam is another example. Countries that were really poor and under terrible social conditions under communism have prospered when capitalistic ideas were allowed to develop. When you read some of the social activists in medicine, they denigrate capitalism as being part of the problem, and that inequality, which is an inevitable consequence of life, that represents something that's spurred on by capitalism, because some people prosper, and not everyone prospers as well as we'd like, but some people really prosper wonderfully, and that's seen as another example of inequality, something that needs to be removed from society. And it's imbued the thought of some of the activists in medicine. So it represents the political, as you pointed out, being inserted into medical care, and as if somehow creating a different political environment is going to change the outcome of illnesses like diabetes and hypertension and cancer, for example.
So distinguish between what goes on with the internal politics at hospitals and now this left and right and the woke policies that are growing, increasingly intervening in what's going on in internal hospital politics. I think you experienced some of that at Penn.
Yes. Well, I'll give you a recent example. So there was a paper that was published that looked at the relative performance of a group of minority residents. In this case, these were people after graduating from medical school. They were Hispanic students. They were African American students, and perhaps some other and Native American students, compared to white students, basically, that were all these residents were looked at 3 institutions: Mass General Hospital, University of Virginia, and Emory University. So these are 3 really major academic medical centers. And what they found over several years of faculty evaluating these residents, now these are post-medical school trainees, but in their residency programs, was that in each case, the minority students performed less well than the white students. Now, the explanation for this in the study was threefold. The explanation was the attendings must be biased, the residents are not in an inclusive enough environment that allows them to prosper, or the system that was used to evaluate the students was a racist system. I wrote a tweet about this, which was perhaps too glib, but the tweet was 3 explanations for this problem. Could it be that they weren't so good as being residents? Which meant that they simply didn't perform as well. Now, that doesn't mean that their performance was dangerous. It simply reflected the fact that the grades were less good in a very large sample, several thousand residents in this sample. I was vilified by my chairman, my former chairman of the Department of Medicine, who wrote that these were racist comments that I wrote. The school itself denied that I was on the faculty there, which was correct because I was now an emeritus faculty member at that point. So they were attacked on Twitter and saying, well, you've got to get rid of Goldfarb. You're not allowed to have these ideas. Again, Salman Rushdie said, not allowing heterodox ideas is the death of freedom of thought. And I think it was important to acknowledge this. If you decide that you have a group of students that are not performing as well, it needs to be remedied one way or the other. Either improve the kinds of students that you're accepting or create systems that improve their performance. The reason I raise this is because it does give a glimpse as to what the pressures are on the faculty. My chairman is a very smart man. He knows very well that if you get a poor grade, that probably reflects, or at least possibly reflects, poor performance. doesn't mean that you treated someone in a biased fashion because you gave them a lower grade. And these are all very subjective, but subjective reviews by many, many hundreds of attending physicians about many, many thousands of residents. So it really represents a strong sample. But it just shows the political pressures that these institutions are under. They were attacked on Twitter. They were worried about their ability to recruit minority students to the institution if their institution is viewed as a, quote, racist, unquote, institution and has, quote, unquote, racist individuals on the faculty, that it's going to discourage minority students from applying. And, I think the point is that the diversity of the house staff and the faculty of an institution have felt to be critically important in order to provide the best medical care. Now, if the way to provide the best medical care is to have the best medical care, not the best Black medical care, not the best white medical care, not the best Asian medical care, but to have the best medical care. And that's my particular view, and that's my view that I was trying to express, again, maybe too glibly in a quote like that. And if you are recruiting students to an institution for non-meritocratic reasons, for reasons of political expediency, so that you can point out to communities and to other individuals that, in fact, you are adopting what's now become a totally accepted notion that unless you have quotas, 12.4% African-American students, 18% Latino students, 64% white students, and whatever other racial group that you decide to have in exact proportion to the population, that you're not a successful institution. Not saying we have the best students and we don't really care what color they are. We don't care where they've come from. We're going to take the best individuals. So that's a good example of the political pressures that these individuals that run academic medical centers are under these days.
Yeah, and that is so important in healthcare, especially because, the difference between mediocrity and excellence could be the death of a patient. That concludes today's episode. We thank you for joining us. I hope you'll join us for our next episode, and thank you for being here.